Good afternoon. My name is Stephanie Rollins. I am a graduate student at LeTourneau University. This video is for learning purposes only. It is just a practice assessment for the counseling program at LeTourneau. For the next few minutes, I'm going to briefly review the assessment of Maria, a 35-year-old Hispanic mother of two and wife to Jose for 10 years. They are a Christian family and attend church regularly. Maria has not expressed any problems in her family life or her marriage, which is another reason that she cannot understand these depressive-like symptoms of fatigue and sadness, loneliness, and lack of interest and in pleasure in the things that she used to engage in. Maria presented with depressive symptoms. We administered the DASS and the Hispanic Stress Inventory too. Now, the results of the DASS, they reflected an extremely severe level on the depression scale, while stress and anxiety were all in the normal ranges. The results of the DASS, coupled with previous depressive episodes and the lack of stress indicators on the HIS-2, suggest a possible biological source of etiology. That being said, Maria will be referred to her family physician, who for the first episode had prescribed her some medication that Maria felt was helpful. So meeting with her primary physician, we can be able to ascertain which medications might be a possibility, as well as a medical, hopefully a brain scan to determine what suggests as deep limbic hypersensitivity. So having a brain scan can shed some light on the biological aspects, as well as possible medications, SSRIs. In light of the mental health status exam, the DASS, the Hispanic Stress Inventory, and assessment has brought me to a provisional diagnosis of major depressive disorder with melancholic features. The provisional diagnosis does meet the DSM-5 criteria. Maria presented with 5 or more symptoms present during an episode, and it does represent a change from her previous functioning. Maria's first episode, the onset was as a teenager, an adolescent. Now, the precipitating factor there may have been a breakup, but the next episode, several years later, was when Maria was in college. There seems to be no precipitating episode or trigger beyond the usual stressors of balancing work and home. Again, not having precipitating factors, as is such with this third episode, lends us again to believe that there's biological factors here that are contributing to these depressive-like symptoms. I know in our text and in our readings, that we are to also screen out for bipolar when presented with these depressive-like symptoms. Um, the bipolar, the bipolar was rejected due to no evidence of mania or hypomania type episodes, at least at this time. We are going to approach therapy from a biopsychosocial approach. The biological factors that I believe to exist dictate maintenance and ongoing assessment of Maria's response to any possible medication or brain functioning that the physician may reflect. Some of the interventions, goals that we're going to work on in therapy is one of the aspects of these depressive symptoms was weight gain, that Maria is really having some self-esteem and self-worth issues over. So we're going to work on eating intentionally and not mindlessly. So to do that, we are going to keep a food journal. Additionally, we would like to explore ant therapy to address negative thoughts or feelings in an effort to release good chemicals that are associated with good thoughts. Briefly, the duration of psychotherapy will be 6 months. The first 3 months we will meet twice weekly. That is to monitor the effects of the medication early on in case we need to make some changes in that area, but also to address and work on the thought patterns and process with ant therapy. So again, meeting twice weekly for the first 3 months of therapy, and then once a week thereafter, totaling 6 months. That is just a brief summary of the approach and process that we will be initiating with Maria.